Guys, this is Caesar with Nursing School Made Easy, and today's lecture is going to be focusing on upper GI bleeds. So we will focus on the esophagus, the stomach, and the duodenum. Now remember that the severity of the upper GI bleed will be determined by whether it is a venous, capillary, or arterial bleed. Now also remember that if the bleed is arterial, that will cause more of the severe consequences, because again you will end up losing large amounts of blood quickly. And also remember that there will be a difference in color between venous, capillary, and arterial blood. Arterial blood will have a bright red color to it. Now another thing that you must also remember is that if the blood ever comes into contact with stomach contents or stomach acid, it will change the color of the blood. So if it is arterial blood, remember that that will be bright red in color. If that blood gets into, again, the stomach, it will most likely turn it to a ground coffee color. And also remember that the longer that the blood stays in the GI tract, the more likely or the more darker that blood color will become. Now that is very important because that lets you know maybe where that bleed is occurring. So let's get started. Again, we're focusing on upper GI bleeds in this lecture. Now there's a lot of information. I'm going to try to give you the most compact information that I can so that you can remember it for your NCLEX exam. So let's focus on number one, the esophagus. Now in the esophagus you can run into some problems, and a couple of problems that may cause a bleed in the esophagus are, we talked about this in another lecture, acid reflux. Okay, that constant exposure to that acid will irritate the esophagus, may cause the esophagus to become ulcerated and therefore cause a bleed. Alcohol. And we can actually put cirrhosis here, because again, chronic alcoholism, one of the things that will result will be cirrhosis. And with cirrhosis, you're going to end up with esophageal varices. Now, with patients that have esophageal varices, you will also look for neck vein distension. And one thing that you want to tell these patients is to avoid coughing and to avoid sneezing if at all possible. So you want to, one, if they're sick, maybe some type of pneumonia, some type of bronchitis, anything like that, you want to treat it immediately to prevent coughing. Again, if there's any type of flu going on, you want to prevent sneezing. Why? Well, if they cough and sneeze repetitively, constantly, or excessively, it's going to increase pressure, and you do not want to increase pressure if they have neck vein distension or if they have esophageal varices, because these varices can rupture, which is why you want to avoid coughing and sneezing or even vomiting, anything again that's going to increase that pressure. Avoid heavy lifting. C. Another reason for bleed would be something like a Mallory-Weiss tear. And this would be excessive retching, excessive vomiting. So you're using, again, excessive force and causing a tear in the esophagus. Now let's focus on the stomach. What are some causes? Number one, or actually, let's go with A here. Peptic ulcers. Bleeding peptic ulcers. So the ulcers, this may be induced, caused by NSAIDs, your over-the-counter medication, your ibuprofen. Okay, so again, you want to educate your patient on the medications that they take. They take ibuprofen, they take NSAIDs for large periods of time, that can cause ulcer formation. Also, if that patient has some type of cardiac history, their physician might prescribe or just tell them to take a baby aspirin on a daily basis. Well, you take that for prolonged periods of time, and again, it'll cause an ulcer. Another cause would be something like a corticosteroid. Maybe this patient has some type of arthritis, maybe some type of autoimmune disease, maybe some type of inflammation. They are given corticosteroids. Well, again, you must inform that patient that, again, that medication can cause ulcer formation. So you got A here. B. This is something called stress-related mucosal disease. Again, stress-related mucosal disease. So this could be something like a severe burn, trauma, or maybe a large surgery. Again, you're causing the body to be stressed. C. Something like stomach cancer. We'll focus on this in a different lecture. For now, simply gastritis, inflammation of the stomach. Now, talking about some causes, what you want to focus on is your patient. So you'll have to assess your patient. You have to know your patient. So one of the things that you have to be good at is, again, assessing your patient. So you want to know their blood pressure. What's their baseline? Are there any changes in that blood pressure? Is their blood pressure dropping? So again, know your blood pressure. Number 2, their heart rate, pulse. Is it weak? Is it thready? Assess it. 3, their capillary refill. Is it less than or greater than 3 seconds? Again, if they begin to bleed, blood is going to be shifted. It's going to be sent to the more crucial organs, and therefore their capillary refill, the time is going to increase. So again, what is your capillary refill? 4, you're going to assess that patient for neck vein distension, okay? Because again, if they have some type of neck vein distension, there's a change in their blood pressure, heart rate, capillary refill, this may indicate that maybe some type of vein ruptured. So again, you always want to monitor your vital signs. You want to do this about every 15 to 30 minutes. Another thing you're going to look at, again, with your vital signs is your respiratory rate. Check their O2 sats. If it's dropping, then you might want to put some O2 on. Put on some oxygen. And this is a biggie, make sure you know this for the nclex. When you assess their bowel sounds, are there bowel sounds? Are they hypoactive? Are they hyperactive? When you touch that abdomen, is it tense? Is it rigid? Is it board-like? Because again, if it is tense, rigid, and board-like, that may indicate some type of perforation. Make sure you know this for the nclex exam. I've seen it on a lot of practice questions. So if you assess your patient and there's tense, if it's rigid, and if it's board-like, again, that will indicate some type of perforation or some type of peritonitis. What is their level of consciousness? Again, they begin to bleed out, especially if it's excessively, if it's an arterial bleed, their level of consciousness is going to decrease. It's going to be altered. So we have something like altered mental status. They will become restless. Again, this would be an indication that they're going into shock. thing to look for, what is their skin color? Are they becoming cyanotic? Is there any pain? And where is it? Now this is important because if they're in a lot of pain, what you're going to most likely end up doing is giving them some kind of pain medicine, some kind of pain medication. Well, you have to be very, very careful as to how much pain medication you give, because if you give too much pain medication, you may actually begin to sedate them. If you begin to sedate them, it's going to be harder for you to assess that patient. It might alter their level of consciousness. You have that combined with them having a potential bleed. It's going to be very, very hard for you to assess your patient. So if you are going to be given pain medication, please make sure you start low and go slow. Okay? Now, let's move on to some interventions. Again, these are the ones that you want to focus on for your NCLEX exam. Sorry, I had to fix my camera here. And we just got done talking about this. You're going to treat pain, but you're going to do that very, very carefully. You want to make sure, you want to make sure you don't give too much pain medication. You do not want to over-sedate that patient. Number two, you're going to give IV fluids. So you may give something like lactated ringers, or if their CBC, their hemoglobin, hematocrit is low enough, the physician may order packed red blood cells. If this is the case, then you're going to need a large IV site. And again, anytime you're giving blood products, you have to be in the room with the patient for a minimum of 15 minutes, because you want to make sure that that patient does not have a reaction. Now, one thing that you have to remember is that when you are giving IV fluids, especially if you're giving, for example, a bolus, or when you're giving large amounts of IV fluids and packed red blood cells, you have to monitor for fluid overload. Especially if this patient has some type of cardiac history. You do not want to overload them. So you're going to listen to their lung sounds. You're going to auscultate. You want to make sure that you're not, again, causing a lot of fluid to accumulate in their lungs. So you're also going to check their O2 sats. Along with this, you're going to monitor their I&O. What's their urine output? If their urine output is decreasing, they're not having very, very much urine production, well, this could mean that maybe some type of renal ischemia, renal failure is occurring. And this will be most likely some type of pre-renal failure. Again, the reason for it is because if the bleed was severe enough, then again, the body is going to conserve blood, focus it to the main organs, the heart, the brain, and it's not going to send it to, for example, something like the kidneys. So again, this would be pre-renal failure. Okay. So again, one way to check to see if the kidneys are functioning or not is again to monitor the I&O, the urine output. Number 4, you might also want to get an EKG. Make sure the heart is doing fine. Again, you're going to monitor the vital signs. If you see any severe changes, you're going to notify the physician immediately. You're also going to assess the stools for blood. And again, you're going to assess and see whether you're going to check and see if it's bright red, if it's a darker color. With these patients, you also want to monitor the CBC, more importantly the hemoglobin hematocrit, especially if you're giving them blood. You want to make sure that you're actually improving. You actually want to make sure that that treatment that you're providing is actually having an effect on that patient. Now remember, when you draw their blood, it may not show the effects immediately. It may take 6 hours, 8 hours, depending on the patient, to actually show some changes. Okay, so if you were to give blood right now, you take the CBC 30 minutes from now, you might not see a big change. You're going to have to wait 6 to 8 hours minimum to see drastic changes. So do not be fooled. If you give 2 units of blood, you take a CBC an hour from now, and you see really no changes. Okay, again, most of the times it's going to take a minimum of 6 to 8 hours for you to see significant changes. You want to make sure that you position your patient with the head of bed up, at least greater than 30 degrees. You want to prevent some type of aspiration, especially if they have some type of esophageal varices, varice ruptures. They have the potential of that getting into the lungs. So again, you're trying to prevent any type of aspiration from occurring. Now, if this patient is, if the doctor says, you know what, you are no longer on an MPO status, you can go ahead and begin eating. Well, you're going to start them off on clear liquids, clear fluids. You're going to put them on a clear liquid diet. Again, this is if it's okay with the physician. But you must remember that whatever you give them, if you're giving them Jello, make sure that it is not red in color. Okay? It shouldn't really be, since you're giving clear liquids, but sometimes you know, you have to make sure that your CNA, make sure that, especially not to give anything in a red or purple color, because you give them something like this and they are suspected of having some type of bleed. You give them that, this red color may confuse somebody and may make you believe that they are having some type of active bleed. So again, make sure you give them no fluids, no clear liquid no clear liquid products that have any type of red, purple coloring in it. Okay. 10. You're also going to tell your patient to avoid alcohol, caffeine, NSAIDs, aspirin, anything that irritates the stomach. So again, you're going to tell them to avoid irritants. You want to prevent a GI bleed from occurring, if at all possible. Now, what are some diagnostic studies? Really, the diagnostic study of choice is, let me get into the camera here, endoscopy. That is really the study of choice. Now, what would you do as far as drug therapy goes for your patient? Number 1, if there is a bleed, give them epinephrine. This will hopefully decrease or stop the bleeding. Number 2, you want to tell your patient to, if they aren't already on it, to begin their PPIs. They're proton pump inhibitors. Again, this is going to decrease the acid secretion. Now I'm going to give you a couple of examples, so hopefully you remember these if you see them on your nclex. Examples of PPIs include Protonix, Nexium, Prilosec, and Prevacid. Now, if your patient is in MPO status, you will give these IV. Something else that you can give are your H2 receptor blockers. And examples of this include Tagamet, Pepcid, Axid, and Zantac. Again, Tagamet, Pepcid, Axid, and Zantac. Again, you can give these IV, especially if they are MPO status. Again, a reason for them being an MPO status is you want that esophagus, stomach, duodenum to get a little bit of rest. You may also give something like sandostatin or somatostatin. And these are going to decrease acid secretion. Again, you want to decrease acid secretion because the acids is what's causing that ulceration. So if you decrease the acidity, you're going to let that stomach, esophagus rest a little bit more and hopefully give it a chance to heal. You may also give vasopressin. And this will be given, for example, for a patient that has an arterial GI bleed. And again, make sure you know this for your NCLEX. You're going to tell them to avoid NSAIDs, aspirin, corticosteroids, if at all possible. And if they do need to take their NSAIDs or aspirin or their corticosteroids, please tell them to take it with meals. And to also take it with their proton pump inhibitor or their H2 receptor blocker to decrease the likelihood of them getting a GI bleed or ulcer. Okay?